The U equals U campaign conveys that people living with HIV who are on effective treatment and have achieved an undetectable viral load cannot transmit the virus to others. Bruce Richman, the founding executive director of Prevention Access Campaign, discusses the significance of U equals U in HIV prevention and treatment.
It enables people living with HIV to lead full and healthy lives just like anyone else. I've been living with HIV for 20 years, and I never imagined that 20 years ago when I was diagnosed that I could, just by taking medication every day to stay healthy, that I also can't pass on HIV to anyone. I can live, I can love, I can have children just like everybody else. And it's important to note that this message is widely supported by scientific evidence. It's endorsed by the CDC, by the World Health Organization, by ministries of health around the world, including Malaysia's Ministry of Health, have endorsed this message. And the message has really contributed to changing global perceptions and policies around HIV. So we're seeing governments, international organizations, and other stakeholders recognizing the importance of the U equals U message and improving access to testing, treatment, and care, reducing stigma and discrimination, and preventing new infections by incorporating U equals U into their country and global guidelines.
Bruce also highlighted the challenges of promoting the U equals U message worldwide.
So despite the World Health Organization and the CDC and the Ministry of Health, including here in Malaysia, that support the message and the science, there are still misunderstandings and misconceptions about HIV. There are still challenges with old ways of thinking about HIV that are not based in current science. We need to educate that HIV is not an easily transmitted condition. It's not possible to get HIV from a handshake or a hug or by sharing forks and knives. These are old, outdated ways of thinking. And then despite the overwhelming science and support around U equals U, misconceptions still exist that people who have an undetectable viral load can still transmit the virus to others through sexual contact. And this misconception often leads to stigma and discrimination towards people living with the virus, which makes it difficult to spread awareness, and that discourages people from getting tested from HIV. So to tackle these persistent issues, we use various communication strategies to educate people and communities about U equals U and spread the message that people living with HIV who are on effective treatment cannot transmit the virus to others.